Connect. I am Lisa Narducci of Centralized Nurse Triage.
And I'm Catherine Oslam, the Medical Assistant Apprenticeship Coordinator.
Okay, so today we want to talk about something a little more serious. Our flu shot season is upon us, and we want to take time to review some landmarks for injections.
I'm so glad this is being brought up now because recently my family member went to go get an injection and unfortunately it was given too low, which caused a lot of pain and soreness for over 2 weeks.
Yeah, it's funny you mentioned that. I've taken calls from patients who have received injections too high and close to the joint and have experienced joint pain as well as radiating pain down their arm.
Wow.
So accurate landmarks are crucial for patient safety, injury prevention, and patient trust. So in this episode, we're going to review the placement for a deltoid injection.
Producers, can you play that video? For an adult patient, the injection site of choice per the CDC is the deltoid. So we will show how to give an injection, IM injection into the deltoid today. You want to make sure that you have all of the items that you need for this procedure. That would be gloves, hand sanitizer, alcohol wipe, gauze, a bandage, and then your medication in the syringe and the appropriate size needle. The appropriate size needle for an IM injection is anywhere from a 22 to a 25 gauge needle. That is 1 inch in length. Other lengths can be used, but it is based on the patient's size and what is needed in order to get into the muscle of that patient. Today we will use a 1 inch. So let's start. First I'm going to sanitize my hands. And you sanitize until it's completely dry. And then you're going to put your gloves on. We're going to find where we are going to put this injection. So we want to go 2 to 3 finger breaths below the acromion process. And in order to find that, you're going to feel the sharp bone on the shoulder. To help you find it, you can lift the patient's arm up to be able to find the end of the acromion process. So I put 3 finger bones, or 3 finger breaths, and this is where it's going to go. So I'm going to go ahead and prepare the site. I will use my alcohol wipe to wipe in concentric circles. I'm just going to prepare my bandage. Maybe. And I like to hold on to my gauze. So from here, we know where it's going to go. We're going to take our thumb and our forefinger and spread the skin out. That is recommended by the CDC. We are going to take our pre-filled syringe or our medication, and we're going to inject at a 90-degree angle into the area of where we found 3 finger breaths down. And you're going to hold the syringe like a dart and insert it quickly into the patient's arm with the bevel up. You don't need to aspirate. You could push the medication in and then quickly pull it out. Use your gauze to cover that injection area. Cap the needle on the table. Never use your fingers to cap the needle. And then apply the bandage. And that is how we give an IM injection to an adult patient.
All right, producers. Well, thank you for that informative video. Hopefully this will help with our education and clinical questions from the staff.
Agreed. All staff will receive a refresher for injection landmarks at the upcoming skills fair on September 6th and 7th.
Okay, well, that's all we have for today. Thank you for joining us on this installment of Council Connect. I am Lisa Narducci,
And I'm Catherine Oslam.
where we connect with you.